Hi, my name is Shane Kuo. I'm a second-year resident at the University of Miami program at Holy Cross Hospital. Today I'm going to talk about my abstract, Significant Esophageal Ulceration in the Setting of FOLFIRINOX Therapy for Pancreatic Adenocarcinoma, written by me, Dr. Natasha Medeiros, Dr. Mary Perianos, and Dr. Idrisov at Holy Cross Hospital in Fort Lauderdale, Florida. Pancreatic cancer is one of the most lethal malignancies. Typically, only 10 to 20% of pancreatic cancer is resectable at the time of presentation, and the overall 5-year survival rate is less than 5%. In many cases, neoadjuvant chemotherapy is implemented to reduce local reoccurrence and downstage a borderline resectable tumor to the point of possible surgery. With limited therapies available, FOLFIRINOX, which consists of leucovorin calcium, fluorouracil, irinotecan hydrochloride, and oxaliplatin, has been one of the first options for advanced pancreatic cancer despite adverse side effects. Our case report is a 72-year-old man with a past medical history of recently diagnosed pancreatic adenocarcinoma who presented to the emergency room with a complaint of persistent non-bloody diarrhea associated with nausea, vomiting, and lethargy. His symptoms started several days after receiving his first cycle of FOLFIRINOX. Upon presentation, the patient was found to be hypotensive with a blood pressure of 90/50, tachycardic with heart rates in the low 100s, and an irregular rhythm with a low-grade fever. Laboratory values on admission were remarkable for leukopenia of 0.1, lactic acid of 2.9, hemoglobin of 8.8, and a creatinine of 2.2, which was at his baseline. Upon admission to the intensive care unit, sepsis protocol was initiated with aggressive fluid resuscitation. Cultures were drawn, and the patient was given broad-spectrum antibiotic coverage for neutropenic fever. Initially, the patient improved. However, 2 days later, he had multiple sizable bloody bowel movements. His hemoglobin responded and dropped to 6.8, and the patient was transfused with several units of packed red blood cells. At this time, the gastroenterologist performed an urgent bedside endoscopy. During this procedure, severe ulcerations were noted throughout the proximal esophagus. In addition, multiple shallow and deep ulcerations in the duodenum. These can be seen in Figure 1. Large blood clots were found and removed via Rothnet, but no actively bleeding lesions were identified. Biopsies were taken at this time for histology and cultures. Given the extensive ulcerations and immunocompromised state, infectious disease broadened this coverage to include antifungal and antiviral medications. In the following days, the patient remained clinically stable without requiring additional transfusions. All cultures at this time returned negative. However, 3 days following the initial endoscopy, the patient had an additional large bloody bowel movement with hemoglobin of 7, which prompted a repeat endoscopy. IV erythromycin was given prior to the procedure, which improved motility and visibility. The endoscopy led to 2 findings: a small duodenal ulcer with a visible vessel and a medium-sized visible vessel that was clipped. This can be seen in Figure 2. The patient remained stable in the following days with no immediate episodes of metachesia. FOLFIRINOX has a strong chemotherapeutic effect. However, it comes with a share of adverse side effects. Common gastrointestinal adverse effects include nausea, emesis, cramping, mouth sores, and diarrhea. However, rare side effects include significant abdominal pain leading to perforation, obstruction, or possible bleeding. This case report illustrates the unique findings of diffuse ulcerations in the esophagus and duodenum in the setting of recent FOLFIRINOX therapy. There are limited publications illustrating that severe esophageal or intestinal ulcerations are even possible as a side effect of this chemotherapy regimen. We hope this case report and its impressive endoscopic findings increase physician awareness of this possibility and encourage research in this topic. Thank you.